Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. This podcast is on a recent JAMA paper, the Tri.Fr Randomized Clinical Trial evaluating Transcatheter Tricuspid Edge-to-Edge Repair in severe TR, assessing it versus optimized medical therapy alone. Study designed, prospective, randomized 1:1 multi-center clinical trial, 300 patients from 24 centers in France and Belgium between March 2021 and March 2023. The intervention group was optimized medical therapy plus transcatheter tricuspid edge-to-edge repair. Group 2 was optimized medical therapy alone. The primary outcome was a composite of a clinical endpoint at 1 year, change in NYHA functional class, change in patient global assessment, and occurrence of major cardiovascular events. The primary outcome was found in 74.1% of the patients who had the edge-to-edge repair versus 40.6% with optimized medical therapy alone, p-value 0.001. Reduction in tricuspid regurgitation severity. Massive torrential TR was present only in 6.8% of the transcatheter group versus 53.5% in the optimized medical therapy alone, p-value 0.001. The quality of life improvement, the Kansas City Cardiomyopathy Questionnaire, the mean score was 69.9 in the transcatheter group versus 55.4% with the medical therapy alone, p-value 0.001. Win ratio of the composite outcome was 2.06, p-value 0.001, favoring transcatheter edge-to-edge repair of the tricuspid valve. This study demonstrates that transcatheter tricuspid edge-to-edge repair significantly reduces tricuspid regurgitation severity and improves patient-reported outcomes, including NYHA class, patient global assessment, and the Kansas City Quality Questionnaire. Safety profile, procedural success was 97.3%, with a low 30-day major adverse event rate of 0.7%. Future implications, this supports transcatheter tricuspid edge-to-edge repair as a viable intervention for symptomatic severe TR. Long-term follow-up is needed to assess mortality and rehospitalization impact.